David Gillatt. I'm the Director of Medical Services at Macquarie University Hospital and a urologist with an interest in cancer and robotics. About 2005-06 it became obvious that a lot of surgery was going to move towards a more minimally invasive approach. The Da Vinci robot is a unique platform at the moment to be able to do minimally invasive surgery, and it sort of changed our practice and our life. The Da Vinci is essentially a way of a surgeon operating from a distance with small instruments that are placed inside the patient. It's a large machine which has several arms, each of which is connected to either a camera or an instrument, and they're inserted into the patient, and you operate them from a console that could be some distance away from the patient if you wish. Most of the time we're actually quite nearby. The advantage is that you get a 3D, very close look at the thing you're operating on through the console, and then you can use the instrument, which operates something like a very small hand inside the patient, and move around just like your hand and your wrist to operate in a very confined space. For example, the pelvis, where you're trying to get at the prostate and the bladder, gynecological organs. It's a very confined area. You can operate with the small instruments in a very precise way, deal with the organs, the cancers you're trying to remove, and then repair everything and construct it again in a way that hopefully gets people to something like they were before the operation started. For most patients now, we can operate on them using robotic techniques with the Da Vinci platform. They can be done with a relatively short stay, lesser impact on the patients in terms of surgical trauma, and for most people it's replaced open surgery with all its drawbacks as a way of dealing with their prostate, their bladder cancers, kidney cancers, and indeed a number of other diseases. It's not entirely replaced open surgery, but I would think probably 80–90% of practice that I do now is with the Da Vinci rather than open surgery with a large incision. Many bladder cancers can have their bladders removed with this technique. Just about every prostate cancer, very few need open surgery now. 99% plus can have Da Vinci surgery. So there's quite a range of options, but certainly the majority of cases we do are prostate cancer, prostate removals. And because it's basically punctures, small instruments being introduced through a puncture rather than a large incision, it means the amount of trauma you inflict on the person is much less. So recovery is, in my view, far quicker, far better, and the operation is more precise, and therefore the consequences of the operation are less if you use this rather than the standard open surgery.